In Uganda, termination of pregnancy is restricted but is permitted to preserve the life, mental and physical health of a pregnant woman, which fact some medical personnel are not aware. Hence, the move to have the guidelines launched. The Constitution under Article 22, Clause 2 states that no person has the right to terminate the life of an unborn child, except as may be authorized by law. Likewise, the Penal Code Act allows the termination of pregnancy, but at the same time criminalizes it. Dr. Charles Kiggundu, the president of the Association of Gynecologists and Obstetricians, says this kind of attitude has seen several women die due to complications arising from unsafe abortions.
An estimate was done to estimate how much it costs the government of Uganda to actually treat women with complications of abortion. We are trying to find out if we pushed preventive measures, if we pushed for safe methods of contraception, how much would we save? And its estimate is about 7.5 billion Uganda shillings.
Some of the circumstances that permit a woman to abort include being raped, the incest with a very close relative, say her father or brother, and in situations where the life of the expectant mother or the unborn child is in danger. Likewise, Dr. Jane Ruth Acheng, the Director of General Health Services, in the preface, said the ministry is committed to reducing maternal morbidity and mortality, a problem she said is multifaceted by legal, religious, gender, human rights opinions.
The health workers trained on this document so that they are able to know when a woman is in front of you and either wants to prevent a pregnancy she doesn't want, or she has had a pregnancy that she doesn't want already, or she has had an unsafe abortion. What can you do for her? We want to reduce the number of women who are having complications or who are dying.
Moses Mulumba, the Executive Director of Center for Health, Human Rights and Development, said the guidelines by the Health Ministry is a good step for women to stop from turning to backstreet allays and go and have safe abortions in proper health facilities.
We expect that the guidelines that have been provided to the health professionals are going to be disseminated to the districts. And then the districts or the other health workers in the public health system, and even those in the private system, could know how to handle the questions of unsafe abortions. But also the standards that they have set as the minimum requirements for the provision of this service, I think, is extremely critical.
According to the new guidelines, when a woman procures unsafe abortion and is in dire need of medical care, such medical services should be provided by a trained and skilled health professional and in a health facility that meets the minimum standards.